right. So in this next presentation, well, they bring it up, we are going to talk about recognition for retail program standards accomplishments. So in this next presentation, over the next few slides, we're going to walk through several program standards accomplishments that have happened since June of 2020, when we established a new recognition program. And our goal here is to take a few minutes during each seminar from this point forward to recognize the work that's being done by all of you, from one seminar to the next. You're all doing a phenomenal job in the most stressful circumstances that I just mentioned. So it's really important for us to take a few minutes to recognize that great work that's being done. Next slide. The milestone certificates and letters are generated for different program standards accomplishments. And you see all of those listed here on the screen. They include awarding for jurisdictions that have conducted full self-assessments of all 9 standards, whether it's the first time you've done it or if it's a repeat, second, third, fourth one you've done, doesn't matter. Also for successfully having standards met and audited. And finally, for jurisdictions that have successfully had all 9 standards audited, we also have a certificate for those. All of these accomplishments recognize a huge investment of work and commitment to your program, and something that you should take great pride in. We encourage you to display these certificates and share them with the employees on your teams and the decision makers within your agencies and organizations. We can't thank you enough for everything you do, and it's an honor to be able to recognize those achievements today. Next slide. So let's start with a listing of full self-assessments completed since June of 2020. Again, that's when this program was established. So we're going back to June 2020. Completing a full self-assessment where a jurisdiction compares their program to each of the 9 standards, conducts a gap analysis, and determines priorities for program improvements. The first slide shows all of the jurisdictions who conducted either their initial or second self-assessments. So we have Island County, Lynn County, Benton Franklin Health District, Clackamas County, Deschutes County, and Liberty County. Next slide. The second slide shows the jurisdictions that conducted their third self-assessments in that time period. As a reminder, full self-assessments are completed by jurisdictions every 5 years at least. So conducting a third self-assessment represents a true commitment to continuous improvement. Yeah, you've been in our program a while now. We really appreciate everything you're doing. Carson City, Flathead City County, Nevada Health and Human Services, Northern Marianas Islands Department of Public Health, Seattle King County, Snohomish Health District, Southern Nevada Health District, and Tacoma Pierce. Next slide. And finally, we do have some that are on their 4th cycle self-assessments. Montana Department of Health and Human Services, Monterey County, California, and Pima County. Thank you so much for everything you're doing in completing that 4th cycle self-assessment. Next slide. Now let's take a look at some of the individual program standards recognition. These next few slides will walk through jurisdictions that met standards and had them verified with an audit. Standard 1 is the regulatory foundation, and that relates to food code adoption. Although we didn't have any jurisdictions meet and successfully have this audited within the last year, I know that many of you are working towards it. And we're, of course, here to support that effort however we can. And we'll look forward to recognizing you at future seminars. Next slide. Standard 2 relates to trained regulatory staff, which includes initial training of staff, standardization, and continuing education. This was successfully met and audited by Southern Nevada Health District, so congratulations. Next slide. Standard 3 relates to a jurisdiction's inspection program, ensuring that's risk and HACCP-based. Great job to Clark and Cowlitz counties for their successful audits within this last year. Next slide. Standard 4 is a uniform inspection program, which is all about quality assurance. We don't have anybody in this category this year, but again, look forward to recognizing you in the future for those of you who are currently working on it. Next slide. Standard 5, foodborne illness and food defense preparedness and response. This is a big one. So congratulations to Southern Nevada Health District again for meeting Standard 5. Great job. Next slide. We don't have anybody who's met compliance and enforcement, which is Standard 6 within this last year. Again, look forward to recognizing you in the future for those of you who are working on that. Next slide. Congratulations to Alaska Department of Environmental Conservation, Clark County, Flathead City County Health Department, and again, Southern Nevada Health District for your great work in meeting Standard 7 and having it successfully audited. Many thanks for your work with both industry and the community. Providing training to industry and telling our public health story to the community is so very important. Next slide. Big congratulations to Washington State Department of Health on meeting Standard 8 for program support and resources. Ensuring adequate staffing, equipment, and resources is so difficult to do, especially in these trying times. Next slide. And finally, congratulations to Riverstone Health on meeting Standard 9, program assessment. This includes conducting a study on the occurrence of foodborne illness risk factors in your jurisdiction and implementing an intervention strategy. This type of assessment is a very important component of any retail food program to determine program effectiveness. Finally, I wanted to take a minute to thank all of you for the work you're doing on the standards, whether or not you are recognized here today. The program standards, the retail program standards are all about continuous improvement. And that often happens incrementally over a long period of time. Never, ever stop seeking program improvement. And thank you so much. We really appreciate everything you're doing to protect public health. David, with that, I believe I'm done 2 minutes early.
Okay, thank you, Chris. That's great. Are there any questions for Chris for either one of his presentations so far? He did the FDA OSCP retail update and the milestone recognition accomplishments from all of you. I don't see any questions, so let me just say thank you, Chris, for your time today. I know you're going to be with us all afternoon, and you'll be closing out at the end. I'd also like to say I'm really